managers in the IT department and a co-lead for Rpiw number 64. And we have a tag time of 20 minutes to finish our presentation. So our project is to develop an improved process for getting the required clinical information, specifically height, weight, and allergies on new patients prior to treatment. Our project aims to improve quality, safety, and also meet provincial HOSHNs and meet accreditation standard. Our theme is to ensure a standard process for obtaining and having a single source of truth for clinical information of all admitted patients for safe medication management. So this is our team. We call our team Hawaii, Aloha. It stands for Height, Allergies, Weight, Assessment, Information, Improvement. And we do have two other team members that are not able to make it to the report. So for us to know the problem, we've collected data since July. And as you can see, there are times that we're in the form wherein allergies, height, and weight are collected is not submitted. When it's submitted, sometimes there are missing information. On the next graph that you can see, it's just a different type of form submitted. Earlier it was the pharmacy form, and now this is the other one is called the allergy form. And as you can see, there are inconsistencies across the board in collecting those information. We've also followed a patient just from client access, from registration, and to ensure that their nursing assessment is completed, wherein the information is charted. However, on our value stream map, as you can see, there are no times on it, just because this Rpiw is focusing on the design improvement of the current process. I would also like to highlight that when height, weight, and allergies are charted, it's almost at the end of the process wherein pharmacy needs the information to dispense the medication. A few starbursts that we have noted is that the pharmacy is phoning for the missing information. There's no single process for getting clinical information, and there are times that no height and weight is recorded. So our tag time is 29 seconds. It means that the medication order comes into pharmacy every 29 seconds. And there's an average of 339 of medication orders coming to pharmacy per day on a 12-hour shift. So imagine how busy the pharmacy department is. So in our for our spaghetti diagram, if we want to make sure that weights are getting collected, we trace the where and how and where they're getting the weighing scale going to the patient room to get the weight. We also followed wherein the several forms are traveling from ED department, from emergency department, level 4, 5, and 6 before it gets to the pharmacy. For our pre-Kaizen target form, I just want to highlight wherein pharmacy for obtaining height and weight, there is 3 major forms, and we aim to have it a one form or a single source. And when pharmacy is missing information, it takes about 2 hours for them to complete, to start even preparing the medication. And I would like to divert this as well, that we are recertifying our lean leadership training. We did a 5S, a mini 5S in the pharmacy department. So you can see in their inventory area, there are clutters everywhere, and we have scored it as 1. But post 5S, as you can see, it's much neater and cleaner. And we scored 3. And now I'm turning the mic to Jenny to give you more words.
Hi, I'm Jenny Roy. I'm the clinical nurse educator for the emergency department. So pre-Rpiw, patients who were presenting to client registration were not being given a bracelet to identify them with an allergy. And so what we wanted to do, our mandate was to alert that patients who presented with an allergy had a red dot placed on their bracelet. And then this policy was automatically developed for patients coming in by either EMS or direct admissions to be part of their admission papers or registration papers to identify them with an allergy if they couldn't identify themselves. So the bracelets became part of an automatic queue to triage nurses, whether they had an allergy or not. It was quite an automatic, immediate reaction from the triage nurse to know. Previously, triage notes did not include an allergy question, and we have now made it a mandatory allergy question on the triage note. The triage nurse or the primary nurse is then responsible for ensuring that there's more specific allergy information documented to make it complete. And after the allergy has been identified on the triage note, an allergy icon is now visible beside the patient's name on the SCM board. SCM is now the main source for allergy information that is attainable throughout the majority of the hospital, like nursing departments, pharmacy, therapies, and dietary, versus looking for an allergy information in multiple locations. And the training regarding these changes and updates is ongoing, while focusing on patient-centered care throughout the hospital. I'll turn it over to Dawn.
Hi, my name is Dawn Mardell. I'm a nurse on level 5. Part of this Rpiw was focusing on not having heights and weights prior to medication and treatments in the hospital. And also having to look in various locations to find a height and weight and the information. In saying this, we developed a new work standard where height and weight are now mandatory within 3 hours of being admitted into the hospital. And it will be charted on either SCM or in the triage note in emergency. Therefore, this will give all healthcare professionals one single source. And this is going to be ongoing treatment, or will be ongoing training for all the levels in the hospital and ICU. In saying this, there are many concerns in the departments about the availability of equipment and for people to do their required duties. So as a team, we redistributed the scales throughout the levels, so everybody has, as of right now, scales that are working, and also the ones that weren't working at the time, they have maintenance recs on, or they are in maintenance being repaired as we speak. Also, another concern on the floor was bariatric scales and how we're going to be weighing our bariatric patients. But I do believe that we have had the go-ahead in regards to this and ordering the equipment possible in order for us to do our jobs, which is awesome, so I thank you. One more thing that we did develop was a new policy. Our nursing admission assessment forms before we had 24 hours to complete the nursing admission assessment, and now that is 12 hours. But in regards to that, we still only have 3 hours to complete the height and weight part of that assessment. Thank you.
Hi, my name is Jade Walters. I'm a pharmacist here at the hospital. And this has kind of been a long-standing issue for us, is not having this available information when we're requiring it, so height, weight, and allergies specifically. So what the problem we kind of looked at in this week is that there's so many different places to look when you need this information. And between those places, sometimes you'll get different numbers for height and weight, or sometimes it'll be missing on some of the forms. So we propose to have one single source of truth for this information, which would be SCM, because lots of people have access to this system. So these are some of the forms that we're currently looking for the information. We have the admission form for pharmacy, the PIP where the patients and also SCM, as well as WinKIS and other options are calling the ward if it's not available anywhere there. Now, after this week, we've gotten rid of these pharmacy admission forms and we're going just to SCM, so that'll be the place that we're looking. This was our SCM view prior to this week as well. It has lots of good information, but there was still some information that we were missing that would be kind of handy for us to have a quick look at, so height, weight, and allergies specifically. So our proposed solution in this case was to add those as a column on that SCM view so that we would have quick access to that information. It's right there. So this is what it looks like now. So you can see we have the allergies, height, and weight for all the patients listed on one screen. The height and weight are also available up at the top, so it's really quick and it's so much easier than looking in a bunch of different places. With these new developments, we created some new work standards. So this one here is for the technicians. We've kind of changed the way we do our admission into our pharmacy system. Rather than looking at multiple reports now, SCM has all the information, the patient's name, their birth date, where they are, as well as the height, weight, and allergies all in one form. The pharmacy work standard that we developed is basically just saying that we have one place to look, so everyone knows where they're looking for this information. During this week, we went around and talked to our pharmacy staff, so we caught some of the technicians and some of the pharmacists. Everyone seemed very excited about this and just to have it available when you need it.
Hello, my name is Sonia Morgenthau. I'm in the IT department, and I'll be presenting information on the system development that was done in SCM to meet the requirements from this Rpiw. This idea summary talks about the issue of manually writing allergy, weight, and height information on multiple forms, allergy form, KIP, as well as other places, and the idea of the proposed solution to make it electronic so that more people have ready access to that information. And the other idea sheet talks about not having a single source of obtaining allergy information and a proposed solution to have an icon that's on the display boards to alert service providers that there is an allergy for that patient. So on the triage note, the development that was done there, there is an allergies section. The top section is mandatory to alert that there is allergy information collected, and then an allergy category. The bottom section is the allergy details, and that's a significant field, which means it's not mandatory, but if it is not completed, the document will be saved in an incomplete status, which means that it needs to be followed up. On the nursing admission assessment, this is mandatory on the nursing admission assessment for the allergy information. And another development is, you'll see that that information is pre-populated. That comes from the triage note. So when it's completed once on the triage note, it will follow through to the admission assessment, so it doesn't have to be completed again. And that is true of any documentation that's done in the previous 72 hours. So it would also be true if there was a patient admitted for a second time and there's another triage note done. That information's already been collected in the previous 72 hours, so it would auto-populate as well. Next is on the nursing admission assessment. The height and weight is mandatory, and as well here is also copied forward from the triage note. This view is the ED status board, and this displays the and-on for allergies. The icon we lovingly refer to as Itchy Scratchy Man is not popular, but it was a standard icon that was already in the system for allergies. So for consistency, we just kept using that that icon as well. And that is generated on all the status boards whenever yes is selected in the triage note or the admission assessment to the allergy question. The next view looks at the main view for a user and just illustrates when you do select a patient, so when the patient is clicked on in the main selection, the height and weight will populate up into the header. So rather than having to find where it is in documentation, you just select your patient and the information is easily available there. And also that shows the icon for the allergies in the patient line as well. And the last slide just looks at the clinical summary. The only change that was made there was we changed the color of the allergy section to red just to make it more prominent so that the allergy information really stands out once it's been collected on the documentation. Thank you.
Hi, my name is Frank and I'm one of the managers for long-term care and co-lead with Joanne on number 64. Our pre-Kaizen waste wheel, we have 9 wastes identified, and post-Kaizen we have 3, so the team worked very hard in eliminating a lot of waste. And our next one here is our fishbone, which showed there was 20 contributing factors to our situation before the week, and then as of now it's down to 5. So we really worked hard to get to that. We did time another admission to level 5, but as Joanne said, we weren't really worried about timing. It was more about the process and consistency and eliminating duplication. So post-value stream, there are still a few Kaizen bursts or opportunities to improve. I'll draw your attention now, instead of right at the end of our process, this information is now available to the clinicians for safe decision making way up at the front end of things. So that's really something to be looked at. So. And post Kaizen spaghetti, there's no more forms floating all over the place. It's one single source of truth. And again, we did sample work on it. So our final target progress sheet here, if we can look at park travel, we basically eliminated those forms floating around. The walking distance for nurses still, for the scales, etc., will be there. But as far as the information going back and forth, we had some really big gains there. We lessened the items. We're down to one source of truth. And on the next page, we're looking at productivity gain. As Joanne said, it takes 2 hours for pharmacists sometimes, and you're getting an order in every 29 seconds. I think we said 339. October 3rd, I think they would have 620 orders that day, so they keep those tracks. So that's, now if they're not looking up to 2 hours and phoning back and forth, and the information's there when they need it, look at the productivity gain for those folks there. Like, it's almost incredible. And then on the next page as well, when we make a profile now that it's available for them, there's big gains there. So I think that's it on that. We didn't leave a lot of things on the event newspaper. The team was very active. We do have a general education where we think nursing and pharmacy has an opportunity around the understanding of how important height is as well. Weight and allergies, but we need education further on height, and then that scale that you spoke to, that key right into biomed, that team's already looking at it. But we also got some very good support on getting some more equipment too, so I'm going to pass it on to
And as you can tell, I'm really pleased, looking at Frank and then myself, that they have focused in on weight or on height. So, my name is Kat Siona, and I'm the patient family advisor. And I'm to talk about lessons learned. And I'm really not going to follow what's on there. The focus of the improvement was on pharmacy receiving the required information, but the solutions trickle down to all of the departments, all the hospital departments. Personally, I have a better understanding of the interrelationships and the cooperation needed by departments to ensure accurate dispensing of medications. It was a real eye-opener. Essential to long-term success will be the availability of resources, for example, functioning weight scales and height tables. All the participants and the staff took ownership of this Rpiw. when you have a team of the right people, it's much easier to reach a solution. One of my initial comments was, why was a 5-day process required? I now understand why this time frame was needed. This was particularly apparent when dealing with the electronic systems development. There really wasn't sufficient time to double check whether the changes were up and running. The support staff, Frank, Joanne, and Sam, were very knowledgeable and committed. The lean procedure kept us all well focused. We could track our progress and results. All in all, safer medication management for patients was definitely addressed. Thank you for your time.
We have lots of people to thank. Brenda Brake is the ITRN, and of course you heard from one of our team members as well, Sonia, and they were with us for the last month and really unbelievable helping us get through. We have all the acute care nurse managers, their educators, Candice and Lori, of course, as our co-sponsors, all the pharmacy staff, particularly Rose, the tech that collected the information and all the data since June and July for this project, all the people in Biomed, Charity and her staff, and the admissions people, pharmacy staff, and then I hope I get everybody. Biomed and materials management, I said. Sam, thank you very, very much for everything, and awesome, awesome support and leadership. And of course, Pat, thank you very kindly for being our family support and all your insights. It was a great team, and it was an honor to be with you guys for this past while. Thank you.